Hi, this is Alexis Gee, and we're going to be doing a presentation on influenza, the effects and that thereof. The infectious agent is the influenza virus. We've got hundreds of strains of the influenza virus, which is why the vaccine can be kind of hit and miss from year to year, and it comes from the Orthomyxoviridae family. The symptoms that you're mainly going to see are fever, feeling feverish, chills, cough, sore throat, runny or stuffy nose, muscle and body aches, headache, and fatigue. Occasional symptoms you'll see more often in children are vomiting and diarrhea. The mode of transmission is droplet transmission. Usually, sick people cough or sneeze out particles with the virus on them. The difference between that and airborne is the droplets, the saliva, or the mucus are not necessary for transmission. The treatment you're usually going to use is rest and plenty of fluids, though in severe cases, antiviral drugs can be helpful. The most common antiviral drug is Theraflu. There's a really big history behind the flu. The first reports of an influenza-like virus originate from Hippocrates from northern Greece in 410 BC. The disease was first called influenza in 1357 when an epidemic in Florence was named Influenza di Freddo, meaning cold influence, which indicated that what they believed caused the illness, which was cold or bad air. It was very common belief that you had good and bad air, and that was what caused illness. Though in 1892, Dr. Richard Pfeiffer isolated an unknown bacterium he collected from his sickest patient's sputum, and he concluded that H. influenzae caused influenza, though it was later discovered that H. influenzae causes infections such as pneumonia and meningitis, but it does not cause influenza. The occurrence rate, you're usually going to have between 9.3 and 45 million infections annually. Of those infections, you have 140 to 810,000 hospitalizations annually, and then you get 12 to 60,000 deaths annually. And usually, for both hemispheres, you're going to have this occurring during the winter seasons. The main reservoir for the flu is humans, however, birds, cattle, and swine can also carry strains of the flu. The incubation period is between 1 and 4 days, but the average incubation period is going to be about 2 days. The period of communicability starts, you start being contagious 1 day before becoming ill, and then you stay contagious for between 5 and 7 days. The most important things you can do to prevent the flu is getting vaccinated, covering coughs and sneezes, avoiding touching mucous membranes, washing your hands often, limiting contact with ill family members, disinfecting regularly, and practicing healthy habits. So stay safe from the flu. Thank you for your time and for listening to my presentation. Bye-bye.